Hello, everyone. This is our neurological group presentation for Miss D tonic-clonic seizures. The group members are Kate, Alondra, Skylar, Jessica, and Starla. So first off, a tonic-clonic seizure begins with only a few seconds and includes a tonic episode, which is stiffening of muscles and loss of consciousness. And then that is followed by a 1 to 2 minute clonic episode, which is rhythmic jerking of the extremities. Breathing may stop during the tonic phase and then become irregular throughout the clonic phase. Some things that put you at risk of a tonic-clonic seizure include history of seizure disorders, sleep deprivation, heavy alcohol use, illicit drug use, trauma to the brain, so any injury or previous stroke that occurs, genetic predisposition, previous brain infections, and electrolyte imbalances. Ways that one can prevent a tonic-clonic seizure is eat a balanced diet and maintain a healthy weight. Wear safety equipment when applicable to protect your head from any injuries. Treat any infections that occur immediately so they don't spread to the brain. Don't abuse alcohol or any other types of drugs. And then avoid any seizure triggers such as flashing lights.
Oh my God. For pathophysiology, a seizure is an abnormal, sudden, excessive, uncontrolled electrical discharge of neurons within the brain that may result in a change of level of consciousness, motor or sensory ability, and/or behavior. A single seizure may occur for no known reason, or some may be caused by a pathologic condition in the brain, such as a tumor. There are 5 types of generalized seizures that may occur in adults and involve both cerebral hemispheres. For documentation, we want to ask how many seizures the patient has had, how long they last, and any pattern of occurrence. Ask about the phase before and after the seizure and the signs and symptoms. Look at pre-seizure activity, aura, triggers if known, onset details, types and characteristics of seizures, and post-seizure status.
The most common nursing diagnoses are that we're going to find for clients with seizures are ineffective airway clearance related to neuromuscular impairment, loss of reflexes, and retained secretions as evidenced by the inability to protect airway during and post-seizure. The second NANDA is risk for physical trauma related to altered consciousness, loss of muscle coordination during seizure, and cognitive limitations. And then lastly, disturbed personal identity related to perceived stigma of being out of control or helpless, as evidenced by changes in lifestyle, ineffective coping, and verbalization of feeling out of place. And then for our diagnostic assessments, the most common ones are the EEG. This records electrical activity in the brain, the frequency, amplitude, and characteristics of the waves. This helps to determine the origin of the seizures and the cerebral function. This is done by placing electrodes on the scalp and then connecting it to a monitor. Next, we have an MRI, and that relies on the magnetic waves for imaging. This can distinguish the blood flow, unlike a CT and the EEG, but it is contraindicated in patients with pacemakers and other older devices, and patients who are confused and agitated or on continuous life support because you need to stay still during that. We also have the CT scan. This one is the most the least expensive. It's quick, easy, accurate, and painless. And it's a 3D anatomical picture of the brain, so it's good for seeing the anatomical structures. And lastly, we have the PET scan. This helps to determine the location of metabolic interaction, and it can help show where the seizures are occurring. During this test, patients are asked to do different tasks and activities to activate different parts of the brain. Now we have the prescribed medications. The first is carbamazepine, which is 200 milligrams twice daily. Our common adverse reactions are ataxia and drowsiness. Although suicidal ideation may occur, and also fatal blood abnormalities. So it's important that we are monitoring the blood cells, CBC panels often. Secondly, we have Dilantin, which is 100 milligrams 3 times a day. The common adverse reactions are rash, diplopia, nystagmus, nausea, gingival hyperplasia, and ataxia. Suicidal ideation may also occur in this one, and it may cause dizziness or drowsiness, although those are not the most common effects, so don't drive until you're aware of those reactions.
Next, we're going to talk about the medication interactions. First, we're going to talk about drug-to-drug interactions with Dilantin, also known as phenytoin. We have diazepam, isoniazid, cimetidine, and valproic acid, which increases the level of Dilantin. CNS depressants, such as alcohol, will increase sedative effects. Phenobarbital and carbamazepine can lower phenytoin levels. Antidepressants can cause CNS toxicity. Carbamazepine can decrease the effectiveness of oral contraception. Antifungals and antiretroviral MAOIs and valproic increase plasma level. It may decrease levels of nifedipine and NNRTIs. MAOIs may result in hyperpyrexia, hypertension, seizures, and death. Food-drug interactions with Dilantin. Avoid alcohol as it increases the side effects and seizure risk. Tube feedings may interfere with absorption, so hold off for 1 to 2 hours before and after the dose. Maintain folic acid, calcium, vitamin D intake as it can affect bone health. With carbamazepine, we want to avoid grapefruit juice as it can increase levels leading to toxicity. Limit alcohol as it can increase sedation and seizure risk. Monitor folic acid and vitamin D levels in the long term. What's a major complication of seizure activity? One of the major complications is status epilepticus. This occurs when a seizure lasts longer than 5 minutes, or multiple seizures occur within 30-minute time frame without full recovery. Complications related to lower oxygen levels, assault on neuronal tissues, and increased metabolic demands. This sudden condition will require immediate medical treatment to prevent permanent brain damage, respiratory failure, or possibly death. Some nursing actions we can take to prevent this would be to maintain the patient's airway, provide oxygen, gain IV access, monitor the ECG and vital signs, pulse oximetry, and ABG results. Prepare to administer lorazepam, diazepam, IV push, followed by phenytoin. A second major complication of seizure activity is also sudden unexpected death in epilepsy, also known as SUDEP. It's the unexpected death of an otherwise healthy individual who has epilepsy or no other reason for their death. Some of the risk factors are patients' ages 50 to 40, a history of long duration seizures, seizure clusters, taking multiple anti-epileptic meds, non-adherence to their medication therapy, lesions on the brain, possible cardiac and respiratory abnormalities, and then 40 to 60% of these cases occur during their sleep. And some of the nursing actions for prevention are to educate on different seizure alert devices, such as a pillow alert or mattress device, having the patient document their seizure activity in a journal, avoid triggers, encourage adherence to their medication therapy, and to promote quality of sleep.
So for patient education, we want to first and foremost educate others around them as well and what to do during a seizure. So we want to stay calm and time the seizure. We want to move objects away to prevent any injury, turn the person on their side to help with their breathing. We want to make sure we're not using any restraints or putting anything in their mouth. And we want to make sure we stay with them until they fully awake. And if the seizure lasts more than 5 minutes, then we want to make sure we call 911. Or if another seizure follows, a first-time seizure, and then if any breathing problems occur. So more on patient education, we want to make sure they're getting regular sleep, avoiding known triggers like stress, flashing lights, alcohol, and make sure they're staying hydrated. We want to track the seizures, the date and time duration, and if there's any triggers that are known, and which medications they're taking, or which medications they take after. And we want to make sure they're wearing a medical alert ID, like a bracelet or a necklace. And for medication education, we want to make sure they're taking their medication as prescribed and making sure they're not skipping any doses or stopping abruptly. And known common side effects, and report any concerns that the patient has. So while we're integrating this into the nursing practice, we want to overall provide a safe, competent, and compassionate care for patients. We want to prioritize patient safety, educate patients and families on medication, adherence, seizure triggers, and emergency response. We want to make sure we're recognizing any early signs if possible, like auras or behavioral changes. We want to monitoring their medication, whether or not it's effective. That way we are able to intervene in a timely manner. We also want to make sure we're documenting thoroughly. That way it ensures accurate communication with the team and supports the continuity of care for the patient. And making sure we're providing a judgment-free zone and a supportive environment. Thank you. And then this is our reference page.